Hi, Sean.
Yes.
Hi, I understand you're in for a cardiovascular assessment today.
Yes, I am.
Okay. Before we get started, I'm just going to go ahead and wash my hands here. All right. Now, if I can see that patient wristband, and if you can give me your full name and date of birth.
Sean Beckler, 11/27/80.
Okay, good. Now, we've already completed the history portion of your exam, allergies, meds, so on and so forth. So we're going to go ahead and move right on to our physical assessment. Okay? If you can just look straight ahead, I'm just going to start by inspecting your carotid arteries here. Good. And now I'm going to place 2 fingers and just feel. We've got good strength, normal rhythm and rate. Again, good strength, normal rhythm and rate. I am going to quickly auscultate that same area with the bell of my stethoscope, listening for any bruise. All right. Now, if you could hold your breath. Good, everything sounds normal. And exhale. And hold your breath one more time for me. All right, good. I don't hear anything there. We are going to do an inspection of your heart, so I want you to sit up nice and straight for me so I can just have a look, seeing if I see any pulsations or anything of that nature. And now I'm going to go ahead and palpate the same areas. Again, checking for pulsations. Normally there's none, and I don't feel any. Good. If you can go ahead and lie down on the table here for me. On your left side, that would be great. And again, I'm just going to go ahead and check this apical area here for any pulsation. And actually I do feel a pulsation there, which is normal in about 50% of people, so we're good. All right, Sean, you can go ahead and lie on your back. I'm actually going to sit you up on my table here to nice 30-degree angle. And what I'm going to do now is check your jugular venous pressure. And this is a good indication of how well your heart is functioning, of fluid status, and things like that. We call it the central venous pressure that we are testing for. Okay, you can turn your head slightly, get my light here. Okay. All right. So we got that at 2 centimeters. So your CVP is going to be 7 centimeters, which is actually perfect. We like it to be less than 8. Okay. All right. Now I'm going to go ahead and have a look at your extremities. Let me start with your arm here. Okay, I'm just making sure we've got good color. You've got nice color. It's nice and warm. The other arm. Okay, again, good color, nice and warm. Gonna move on down to the feet here. Look at your legs. Nice and warm again. Good color. All right. Now I'm gonna go ahead and palpate your pulses. Okay. I'm gonna start with your pedal pulses here. Good. They're normal and equal bilaterally. Move on to your posterior tibial. Again, normal, equal bilaterally. And we're going to work our way up here to your femoral pulse, which is right in the groin here. So go ahead and palpate those. Again, normal and equal bilaterally. Now you've already told me in our history that you didn't have any leg swelling, but I'm going to check for edema, make sure there's no fluids pooling in your legs. Good. Good color return. No indentation. That looks good. Now I'm going to go ahead and check your radial pulses here. Good. Nice and normal. Equal bilaterally. And your brachial pulses. Again, normal, equal bilaterally. And if I could have your hand, I'm going to do a nail inspection. Good. We've got good curvature, good color, good shape. And I'm going to check your capillary refill. I'm going to just kind of squeeze down on your nail edge here and make sure we have good color return. Good. Came back immediately. Less than 3 seconds is good for good blood flow. Again, this hand, nice and warm. Nails are nice curvature and shape, contour. Going to check that capillary refill. Good color return. And to your feet. Toenails are nicely shapen, good contour, nice color. Checking capillary refill. Perfect. Color return. Other one here. Shape is good, contour is good. Checking capillary refill. Good. And good color return. Okay. All right. Now I would like you to sit back up on the table, and I'm actually going to listen to all your heart sounds. Okay. All right. Okay. All right. So this could take a little bit of time, but I'm just going to be listening to each point in your heart to make sure everything is normal, the rate is regular, rhythm is regular, things like that. Okay? All right. Good. All right, and I'm going to go ahead and get your heart rate now. Use my little stopwatch here. All right. So your heart rate is actually a perfect 60 beats per minute, which is good. We like it to be anywhere between 60 and 100. Your rate sounds regular, rhythm regular, normal. Okay. I'm going to listen with the bell of my stethoscope quick to make sure we don't have any abnormal murmurs or abnormal heart sounds. All right, everything actually sounds really good. So your cardiovascular assessment is complete and everything is perfectly normal. Did you have any questions for me?
No, no.
Okay, well, if you did have any questions, feel free to give a call back and we'll be able to get those answered for you. Okay?
Thank you very much.
Thank you.